What if the biggest missing piece in medical AI isn't a smarter model, but your own health history? Imagine asking an AI, "What does tachycardia mean?" Without context, it gives a generic answer. But with your personal health record, your conditions, medications, symptoms, and history, that same AI could give a response that is far more relevant, personalized, and clinically useful. In this video, we'll explore how personal health records, or PHRs, can dramatically improve AI performance in healthcare. We'll look at a study using over 2,200 medical queries and nearly 2,000 PHRs, compare AI responses with no context, basic context, and full patient history, and break down where PHRs help most, and where privacy, safety, and reliability concerns still remain. By the end, you'll see why the future of medical AI may depend not just on better algorithms, but on better context. Let's get into it.
Let's dive right into this explainer because today we're looking at a fascinating, newly released study from Google Research. It tests something absolutely crucial. Exactly how well can large language models, or LLMs, answer complex medical questions when they actually have direct access to your personal health records? As we all start relying more and more on AI, this collision of artificial intelligence with our highly sensitive personal data is definitely something we need to unpack. To really grasp the core problem this study is trying to solve, imagine you just asked a chatbot this exact question. Now, tachycardia simply means a fast heart rate, but without knowing if you have a documented history of heart issues, or if you're currently running a fever, or, if you just drank way too much espresso this morning, how could an AI possibly give you a safe, useful answer? Well, it can't. It essentially has to guess, or just spit out a generic textbook response. So here's the thing, the quality of an AI's answer suffers immensely because of massive blind spots in its understanding of your specific context. And even if a chatbot asks you a few clarifying questions, you might not even realize that a minor surgery you had, say, 5 years ago, is the exact missing puzzle piece the AI actually needs to figure out your current problem. Here is our roadmap for today. 1, the baseline problem. 2, the data collection process. 3, testing 3 context levels. 4, major performance improvements. 5, lingering risks and errors. And 6, the future of AI health.
Section 1, the baseline problem, generic AI in healthcare. What's truly wild here is the sheer scale of adoption. People are not waiting around for the perfect medical AI. They are already trusting general chatbots with their health data right now. I mean, around a third of US adults are asking AI health questions, and an astonishing 41% of those users are actually uploading their personal medical info to a chatbot. With numbers like that, it's absolutely imperative we understand how these models actually handle complex, messy health records.
Section 2, the data collection process. Curating the test. To test the AI properly, it wouldn't be enough to just feed it simple textbook questions. So the researchers went out and gathered a really diverse real-world set of 2,255 medical queries. They pulled these from 3 distinct sources to cover the whole spectrum: short everyday web searches, longer conversational chatbot templates, and incredibly complex real patient concerns that were actually recorded by nursing staff over the phone. Then they set up what is essentially a massive matchmaking operation. They paired those 2,255 diverse queries with almost 2,000 completely de-identified personal health records. The researchers were basically trying to see if the AI could act as a true personalized medical assistant, connecting the dots between a user's random question and their deeply detailed real-world medical history. Section 3, testing 3 context levels, the methodology. So how did they actually measure the AI's success? They tested the Gemini model under 3 distinct conditions to see exactly how much medical context is needed to get a genuinely helpful response. Step 1, no personal health record. The AI just answers blindly. Step 2, a basic health record. Think of this as a quick snapshot of age, conditions, and meds. But step 3 is where it gets super intense. The full health record condition fed the AI extensive clinical notes, averaging over 10,000 words per patient. Section 4, major performance improvements, the results. Let's see how providing all that context translates to real-world impact. In one actual example from the study, a user asked about leg pain. The generic, blind model just assumed standard shin splints and told them to do some toe raises. But the full health record model? It looked at the patient's history, spotted a past case of deep vein thrombosis, which is a really dangerous blood clot, and immediately flagged it. The context-aware AI caught a potentially life-saving connection that the generic AI entirely missed. And that anecdotal success translated to the hard data perfectly. When actual clinicians graded the overall helpfulness on a scale from -1 to +1, adding just the basic personal health records caused the rating to massively jump from a baseline of 0.13 all the way up to 0.53. To put that into perspective, that's a quadruple increase in perceived helpfulness just by giving the AI a basic summary of who it's talking to. Using the SHARP evaluation framework, we can see that providing medical context didn't just make the answers more accurate, it made them significantly more actionable and motivating for the patient. The AI wasn't just giving a dry medical lecture anymore, it was giving targeted, practical next steps that the patient could actually use in their daily life. When you map all this out, the consistency is incredibly clear. The evaluations constantly show the models equipped with basic and full health records scoring noticeably higher in helpfulness across all sorts of question types, leaving the blind baseline model totally in the dust. The conclusion here is absolutely undeniable. Context works. Section 5, Lingering Risks and Errors, the nuance. Now hold on, because we have to look at this impartially. Giving an AI thousands of words of unstructured medical history isn't a magic fix. It actually introduced some very unique risks. The study found instances of grounding issues. Sometimes the AI would outright fabricate numerical lab values. Other times, it suffered from what they call temporal disorientation. Basically, it might scan a massive file, zero in on a biopsy from 5 years ago, and mistakenly anchor its advice to that old, resolved issue instead of focusing on the patient's actual current problem. But here's the good news. The researchers tested a really clever solution. They applied a simple automated self-critique loop, essentially forcing the AI to double-check its own timeline logic. And guess what? That reduced those critical time awareness errors by over 97%. They dropped from 162 errors down to just 4. So this proves that while the risks are absolutely real, they are highly correctable with the right engineering. Section 6, The Future of AI Health, What You Should Take Away. The data here is crystal clear. Context is the absolute key to unlocking highly personalized, actionable, and potentially life-saving medical advice from AI. The jump in helpfulness is staggering. But, as we've seen, the system isn't completely flawless just yet. Those grounding and timeline errors absolutely require robust safety rails before this rolls out everywhere. So I want to leave you with this final thought to ponder. Knowing the immense benefits, but also the current engineering hurdles. Are you ready to share your complete health history with an AI today?